There you go.
Awesome. Thank you. All right. Well, good morning, everybody, and welcome to the first of, I hope, many Qualitative Tuesdays where we'll have a monthly meeting to discuss, kind of hijack the qualitative data science call and take away from the numbers people and do a little bit more qualitative research topics and discussions. So I'm really excited to start us off with a presentation today on rapid techniques in qualitative research. And um, we chose an article that is a critical review of the literature from 2020. And what I would like to do in this presentation is we're going through the systematic review and the findings of the review is um, to use it as a starting point of to say what is being used, what are different techniques, what are some of the considerations that the authors point out, and then have that as a basis for a discussion. And then at the end of the presentation, um, we'll have an application example of how rapid qualitative techniques were used kind of in the field. So the article is linked here. There's also the QR code if you want to pull it up for the presentation. All right, good. So as you all know, there is a time pressure to rapidly share qualitative findings, especially in health research and clinical research. Um, to inform policy and practice, there is this pressure to produce findings quickly. Um, Sometimes you also are impacted by kind of the landscape in which the research is being produced. So, funding landscape, which might change quickly as we all are experiencing these days. Priorities of funders or researchers, and then also the public policy, right? So there's a lot of moving pieces that really require us to be able to be adaptable and to also produce findings quickly to inform the next steps versus the traditional qualitative research, which tends to be more time intensive in terms of data collection than also the analysis. Um, so there is growing attention overall in the field, but especially I think within the healthcare field to develop approaches to reduce the time for data collection analysis. Um, so there are different research approaches that have been used for rapid methods, and we're not going to go into all of those. Um, was there a question? Are you good? Okay. Um, so those are just some of the approaches, and the authors did a really good job, and also referencing all of those if that is something you want to look further into. Um, And then they talk about the different techniques. And this systematic review really spends more time on the techniques rather than the overall kind of approach or study design idea. Um, with the intention to reduce time for data collection, data analysis. Okay. So even though there's growing interest, more and more people are using rapid techniques, there seems to be a lack of the synthesis and a critical review of those techniques. And this is what the authors are aiming to do with this systematic review, to explore the ways in which data collection and analysis methods have been adapted to deal with short study timeframes. So in order to do that, they conducted a systematic review using the PRISMA guidelines, and then they analyzed the benefits and the limitations of each of the techniques, and then also provided some recommendations for further development. So an overview of the systematic review, they employed a two-phase method. So the first method was to include articles describing rapid qualitative collection or analysis techniques. You'll see the terms that they used here. And then in those articles that they identified through this search, if they found new words that also related to quality or to rapid techniques, they included that in a second phase of the systematic review to make sure they really capture everything that relates to rapid techniques. All right. The search was conducted in 2018 and then in 2019 again to make sure that they included all of the most common, all of the most recent articles. And then, of course, duplicates were reviewed and they used RefWorks as a software for the screening and full text review. Um, they had two reviewers going through all the titles, abstracts, and then full text, and a consensus had to be reached to be included in the full text. They did not exclude articles based on language or publication dates. And they included publication in peer-reviewed journals and included articles that had a self-identified adaptation of data collection to be a rapid technique. And then also said that, they self-identified using a rapid study component. For data extraction, they used a data extraction formulated in REDCap, and they piloted that based on a random sample of 5 articles by both reviewers, and then discussed it again until consensus was reached, and used that for the data extraction. So then once they had the data extracted from the systematic reviews, they started with the analysis based on their research questions. So here are the 5 research questions outlined that they had. One is, how are rapid data collection analysis techniques defined? How are adaptation of methods defined and justified? What are the stages of research that normally experience modifications? What are the benefits and limitations? And then what recommendations can be made for future development? Once they had that, they created a descriptive synthesis of the findings, again, by both authors, to then discuss and compare and combine. And they did not do a risk of bias assessment of the articles included. All right, so with that approach, they ended up including 18 articles with a publication date between 1992 to 2018. And coming from, as you can see here, United States, Canada, United Kingdom, Australia, and New Zealand. And then the adaptation method that was used in all of these articles was either the elimination of transcript or the time reduction of transcript creation. And that seemed to be the main, those two seem to be the main components of, adapting conventional methods to rapid techniques and to save time. So to go a little bit more into detail into what techniques were employed in the articles that they included, one was that they used voice recognition softwares or scribes, so an independent note taker during the interview to create their text for data analysis. So it could have been that they said, instead of we're using voice recognition software to create our transcript from audio to text, or that they used, like I said, independent note takers, and then the notes that were taken were the basis or the source for the data analysis. Some people used techniques that included simultaneous data collection and analysis. So, for example, mind mapping during focus group discussions, where you're collecting your data and at the same time analyzing it by interpreting it and receiving participant feedback. Other techniques were coding the data directly from the audio or visual source, or a combination of both. And then another one was the combination and analysis of audio recordings and interview notes, including reflective journaling immediately post-interview, and then listening to the recording and revising the field notes and observations. So you see here kind of that then moving away from the conventional full transcript document content or thematic analysis. Another group used rapid usability analysis, which is basically a rapid synthesis and interpretation of the qualitative data using predetermined, so deductive coding methods. And then another technique is the radar technique. And I have all those references linked at the end of the presentation, but also in the article itself. So if you want to go back and learn more about some of those specific techniques, I invite you to do that. But the radar technique basically is a use of tables or spreadsheets in several iterations to, in each phase, reduce the qualitative data um, to text that is relevant to the research question. So it's kind of like a reduction approach in the data that is used during the analysis process. So the reasons why authors chose to use rapid techniques was, as we were saying, for one, the reduction in time and cost. Um, Reduction in cost for one, because if it's quicker, the research team will not to will be costing less because they don't need to work as much. And then the cost for transcription services, um, which then it in turn leads to the ability to collect more data, but also improved efficiency. They also mentioned the improved accuracy by reducing errors and interpretation errors through transcription. And I'll get back to that in a little bit later. And then also the improved accuracy in approaches such as the mind mapping, where the participants are able to validate the researchers' interpretations in real time. And with that step of using either directly audio or doing mind mapping, kind of, and having that real-time interpretation, um, they point out that you can remain very close to the narrated realities of the research participants. All right, and then there were a few studies included that, in addition to kind of the purpose of why they used rapid study methods in their personal study objectives, they also included a more general justification of rapid study methods and um, point out that it allows for reliable and systematic data analysis and that it is comparable to conventional methods and that it allows for a contemporary method for technology use, not only in the data collection, but also in the analysis and dissemination. And again, that it demonstrates the meaningful participation of research participants in data analysis because it allows you to have that real-time validation and interpretation of your results with your participants present. All right, so out of those articles, less than half, 8 articles, actually evaluated the techniques that they used in the study that they published. So the studies that did not use any transcripts, they performed a comparison of the developed codes and themes with a subset of transcripts that they then created. And here we can see that they say it generated the same broad themes and it was within the range of acceptable reliability. The studies that did use a form of transcript, but then, the rapid technique was more using, for example, the voice recognition software, they found that there was like it actually took about the same duration to have the voice recognition for audio to text transcription than the manual transcription. Um, but they do say that there's a potential ease of physical and mental stress of somebody having to listen to the recording and then typing it down for anybody who's done that for like an hour long interview. knows what physical and mental stress they're referring to. And then also saying that there is a benefit for slow typers or persons with disabilities who may not be able to type physically, right? And then the direct coding from audio or coding from notes taken by external observers during the interviews. Again, here they say that they had similar findings to the conventional methods, but that it required experienced researchers. Okay, so identified benefits. The authors state that there is a reduction in time, more data can be collected, you can have more research participants, and the cost, as we mentioned before. But they also mentioned that with using or coding directly from voice or video, you're able to maintain a lot of nonverbal information, which also allows us then to kind of limit the interpretative bias and the opportunity for human error in that step of having our raw data, whether it's voice or video, to a text document. And they also point out that there might be a better match between the theory and the design. So, for example, with mind mapping, because it is an iterative process and you have circular interpretations where you generate something in discussion with your participants and then you circle back and say, okay, what do you mean by that? So you have a little bit more of a checks and balances, and you have that iterative and circular approach. And they also say that rapid techniques actually can enhance the transparency of the data analysis process. Again, I think back to the mind mapping, for example, where you have the participants involved in the analysis process. And it can increase the physical comfort during analysis. Again, they mentioned the example of the voice recognition software, saying that you don't actually have to type the transcript. On the flip side, there are some identified limitations. One is that the pace in group discussions might be reduced because you will need additional time to write down your data and kind of analyze as you go during the data collection. So it might interrupt the flow of a discussion if this will be your only data source would be somebody, for example, who's taking notes or the mind mapping. There's the potential to have less depth or room for interpretation if you are using rapid techniques. And they mentioned that there's a greater chance to introduce researcher bias by, for example, editing the audio or video footage or misinterpreting the data. It still potentially requires the selective use of full transcripts or other methods. And it also takes time to master any new technologies or methodologies. It's not something that, without training, anybody is able to do efficiently and effectively. There might be a cost connected to purchase any new technology. And there could be a potential data loss if you code directly, for example, from the audio source or relying on notes, and maybe there wasn't an audio recording at all. So then you're really relying on whoever's taking the notes that they will be complete. With that also comes the question of, the availability of experienced researchers and note takers. So one study, for example, employed court reporters that are able to transcribe as somebody speaks. But of course, not everybody will have access to use a court reporter who can create a transcript during the data collection phase. And then the other part is the potential lack of sophistication of technology. So, and again, this study includes articles from 1992 to 2018. So, now we've come a long way with voice recognition and text to audio to text softwares, but there might be some challenges with the technologies used. Okay, so then when we think about recommendations, the authors mention or conclude that for one, it is applicable in especially the applied research settings, so in the space that a lot of us work in. Um, it also allows to generate consensus among diverse groups. So again, I think about the mind mapping, for example, it allows, because of that iterative approach and circular approach, it allows to create consensus within groups who may seem to have opposing ideas. Um, but they also point out that it is not appropriate for all research settings and that it requires methodological adaptations. So as I said, multiple team members, experienced researchers to be able to employ any new innovative strategies. Um, and then the team needs to be willing to engage with new methods and technologies because there is a learning curve in that. And then also ethical uncertainties. So with the introduction of rapid techniques, are there ethical challenges that we need to be aware of? And thinking about is our study or our research setting appropriate for rapid analysis or data collection? And then they point out that for future research, they really emphasize the need for additional assessment and to determine the reliability and the data quality. And then also the opportunity for the increased participant involvement. So in conclusion, they mentioned that based on the systematic review, the articles published until 2019 used rapid techniques mostly in the data analysis stage. And they talk about the choice and the benefits of data source for coding. So whether, can you code from audio directly or use a transcript? And then the transcription process, they point out that this is something that's often taken for granted, which I think we all agree this used to be the standard procedure. You have an audio text and you transcribe it, and you do that first and then um, you kind of move along. But they also point out that that transcription process might impact the nature of the data. And they reference one of the articles that they include that says transcription is never theory neutral. So again, thinking about, is there um, an introduction of potential biases? So their conclusion here is that we really need to be careful and be very transparent and have a critical approach to transcription processes, which is something I think we could have, a session only focusing on transcription processes and how to document that properly in our methods section for article submissions and those kind of things, because it is, I think, often um, neglected to be as transparent in that actual approach. So I really appreciated that they pointed that out too. Okay, so this is the overview. Um, the other thing, and again, this is from 2020, right? So there were a limited number of techniques evaluated, and they really would like to have additional research to compare not only the reliable of the rapid techniques with the conventional methods, but also comparing different rapid techniques to each other. Um, and then we have the technological advancements. However, those need to be evaluated too, right? So what is the impact on the research? Um, does that actually increase the demand that is placed on researchers? What is the quality of the data that will be generated with advanced technology? And then again, thinking about the interpretation of data, are there increased possibilities or do we have maybe a lack of interpretability? And then needing to review the functionality of rapid techniques on an individual basis. So going back to saying it might not be appropriate in every research setting. So they really point out, having to think through your own projects, your own circumstances, your own research questions to see how functional rapid techniques actually would be. So their conclusion is that, there are evident limitations, but that there are several approaches that, if properly implemented, can reduce the amount required for high quality, in-depth qualitative research, and then potentially facilitate the use of findings and changes in policy and practice. So really, again, thinking about the more of the applied research, and they focus mostly on the healthcare setting, but having that quick and efficient use of qualitative data. All right. So this article, the authors are part of the Rapid Research and Evaluation Lab, and I linked their website here. They have a lot of really good resources and a list of publications that speak specifically on rapid evaluations. So I highly recommend you all to check that out. Um, yeah, it's a great resource to kind of see, some different approaches, ideas. They have a few overviews of kind of their own protocols and standard manuals, which is nice. All right. So we have 30 minutes left. So I would like to invite Dr. Felipe Murta and Dr. Alicia Casau dos Santos. I'm sorry if I said that wrong. From FMT to talk to us a little bit about, an application example of how you all employed rapid techniques in one of your studies. Welcome.
Thank you, Anna, for your presentation. Um, Thank you all for this moment between our institution. I really believe this is a way to strengthen our relationship, especially discussing um, qualitative research and methods. So, I want to share our experience, just a little bit. Uh, we know this technique in 2021, maybe, when a researcher from the United States come to Manaus, and we try to evaluate this package for a new malaria drug treatment called tafenoquine. So we try to understand how, especially, caregivers, how they understood the instructions in the package. So GSK tried to develop a new drug for children, a version of this tafenoquine for pediatric tafenoquine. And one part of this process is try to develop a new package with instructions, because the medicine needs to dissolve in water. Dissolve, correct? Okay. Dissolve in water, and there is many procedures to take this drug. So we try to use this technique in rapid qualitative research to evaluate this material, PID or package. It's a I disagree a little bit, because the article says you save work, with using rapid qualitative analysis. But for us, save work means more work. Save times means more work because this debriefing sessions, because we went to the field work, interview people, take note, and then after this, we had debriefing sessions. So was so mental hard for us. So in our opinion, we need to how to say that we need to use this technique with careful, especially when you have a short time to get these results. Then we use another, we apply this technique in another study when we try to understand how people during the implementation of these medicines, how people were understanding and try to see acceptability, feasibility in healthcare professional and patients with malaria. So we interviewed 149 people, a lot of data, and we use a rapid qualitative analysis and a short interview guide. Not a short, maybe it's not short. I don't know. I don't remember. But the interview was very fast, and this big work resulted in two articles, one published in Malaria Journal and another in PLOS Neglected Tropical Disease. So for me, it's a important technique, especially in implementation science context, especially when you are implementing a new drug or new technology, when you need a short answer for a specific problem. But in otherwise, for indigenous population, for example, it's impossible to use these techniques because we need more deep, more time to make the report. And so in our experience, we use only when we need a big demand or when we are looking for just a simple thing or implementation, a point of the implementation. Okay, Alicia.
Hi, Anna. Hi, everyone.
Really
So, nice to see you again.
nice to see you.
I had some opportunities to work with rapid qualitative analysis, and I was thinking about the coding from the audio. So we did this here, but I think it's, in my opinion, it's a little stressed, mental stressed, because you have to listen again and again the audio. But I think that make the debriefings before, it's really important because you can mark the important parts from the interview and reflect after this. So when you have contact again with the interview, you transcribe just the part selected. So this is something that really helped us here. And also, I was thinking about the reduced costs here, because we are in the Amazon, in the Brazilian Amazon, and travel here is really expensive, and the field work also is it's really hard. Sometimes we are going to remote areas, so try reflect in the field and start to think about the data analysis. It's something that really help us here. I think this these were my experience, and I think I agree that it's not a for make deep research, for example, for understand the perspectives from indigenous population or the perspective about the world, about the thing. But I think it's really important using this to evaluate programs and medicines and technology. And we are doing this here. Recently, I started to do this with the anti-venom decentralization. I don't know if you know the saving program. Yeah, we started to do this, and it was really hard analyzing this data, but I think this approach help us because we use it specific domains from implementation outcomes. I think the author is Proctor and et al. And so we have specific domains, and we just started to code it a specific part of the interview. So this helped us because we need to adapt to the protocol to the professionals and also to the users. So was really important to do this to, how can I say, to save time. Yeah, here. So basically, these are my experience here. Yeah.
But just one final comment. During the implementation of tafenoquine, this medicine, we use this technique to provide fast feedbacks from MOH, Brazil Minister of Health. So during this implementation pilot, because this study was an implementation pilot in Brazil, 2 cities in Brazil. Nowadays, we have this medicine around the Brazilian Amazon, but we provide many feedbacks, important feedbacks, and we can change the training program because of the rapid qualitative analysis and technique. So our group made an important contribution for this implementation. And I heard from Qualitative. Qualitative, it's a part of Minister of Health in Brazil, who like a FDA in the United States. And they told us, for the first time, the qualitative research are using in implementation process. So they love this idea to use this perception of patient and healthcare professionals. And in the final comment, we had many fights during the debriefing. So we lost one collaborator for this. Yes. So it's more stressful than traditional transcription.
Sorry, Felipe, can you say more about that? Like, what were these conflicts?
Oh, because during this work, we had a short time to provide this result, and we had a short time to make these interviews and debriefing section. So during one day, during a day, our people went to the house, talk to the people, and in the end of the day, there were these sessions, this debriefing. So people are so stressful, and we need to, okay, we need more, we need more. We interview 149, so a lot of
And
a short period.
yeah, and about softwares, I think it's okay make this in Max KDA, but we also make this in a
Yes.
table on Excel.
Spreadsheets
Yeah,
in Excel.
yeah,
Mhm.
it's okay, organized and summarized there for us. In my opinion, making rapid qualitative analysis is better in spreadsheet.
Yeah.
Yeah, because you can visualize all the data, and also you can put the briefings there in this spreadsheet also, and the part of the day. Yeah,
More flexible, huh?
yeah, yeah.
Great. Yeah. This is really really great to hear kind of the application on two different studies, and like you're saying, the opportunities and the possibilities that it gives, like you're saying, Felipe, that qualitative research for the first time informs kind of, Ministry of Health level decisions, right? Um, and with that, it includes that pressure of saying, if we want to have qualitative research be part of those discussions, it needs to be efficient, right? They won't wait for you to have 149 full transcripts thematically coded, and right, I mean, that will take a long a long time. So but I was wondering too, what you were saying, the intensity of the debriefings, because you're already starting to almost kind of analyze and interpret, right? And I think that with that, as stressful as it can be, there is a lot of value in having that shared decision making, shared interpretation. And I was wondering too, Alicia, what you were saying, being in the Amazon and travel is expensive, but also time consuming. Um, Using rapid techniques there to maybe also be able to share some of your analysis with the participants while you're there, can be really, really helpful, right? Because you may not be able to go back and say, hey, this is what we interpreted. Do you agree with that or not? So you might actually be able to have several iterations um, of your data while you're there if you have some of those rapid techniques, right? Especially when we think about like global health research, it can be really challenging to reach those same participants again, potentially, to include them in more of the analysis process than just having them be the informants, basically. But- Awesome. Cool.
What about you, from Duke side? Do you have any experience with this technique in your work?
Yeah, so I've started using the like audio to text transcription, especially in remote interviews. And I think, the technology has definitely gotten better, that it is quicker to do that now, even with the proofreading. Um, Again, that also depends on the language you're interviewing in, people having accents, how good is the quality of the sound, all those things. So, but I will say that this is something that we started doing, and I have good experiences with that. It's not perfect. You definitely need to proofread, and maybe you need to have two people to proofread. Um, and then we just started using, or testing out rapid analysis for interviews that we're doing in Tanzania right now for also the development of more of a policy document. So this would be rapid analysis. So we have a predefined kind of coding sheet that we're using, which has been done with a CIFAR implementation science framework in the past too. And there's actually a study that evaluates that it produces reliable and high quality results. But yeah, I mean, it's interesting because we're trying to do that again on like an international study where we probably interview people from different countries as well. So seeing also then, and using that as an opportunity to compare how the application, for example, of that coding sheet works in different settings and with different levels of experience of researchers as well. Because I think there's something to there's something to be said with what they're saying, the level of so you can train everybody almost everything, but being able to maybe do that rapid analysis, like you were saying, Alicia, just listening to voice, for example, or maybe that requires a little bit more training and expertise and just practice on maybe text-based analysis to kind of be able to learn to pick up themes or to pick up codes. So I think that would be really interesting to see more of those comparisons, and maybe also the comparisons of native speakers in the language versus, now everything is translated into English for the ease of publications, but how much is this potentially lost there if we could do rapid analysis on the original language of the actual data collection. So yeah, I think there's a lot of different questions still. And also the question of artificial intelligence and how that will be used in the field of qualitative research and analysis specifically. And then, we're opening a whole other topic of ethical considerations, IRB considerations, all those things.